Thank you, Dr. Stewart. Good evening, everyone. Graduates, you look lovely. I would like to, first of all, extend my heartfelt congratulations to you. It must be an extremely proud moment for you, the families, and all of us here and your family at Chad. Also to extend congratulations to Mrs. Carnegie of the College of Health and Allied Development. This ceremony this evening bringing to us to the end of this conference is an example of us not only talking the talk that we were doing this entire week, but also walking the walk in producing and training individuals, or these three ray of light, ray of hope, for us to address the healthcare needs of our region within the Caribbean and in Jamaica. So congratulations and thank you. Now this evening I will try to be as short as possible because I know it's late in the evening and this is not my intended audience for this address, but I think it is also fits well with my address, because what I'll be speaking about is the health challenges that we face within our Caribbean region, some of which we discussed over the last 3 days. And you graduates, you are an important part of the solutions to these health challenges that we are facing. So I want you to listen carefully to see what niche you are going to fit, where you're going to put yourself and your focus on in addressing these challenges going forward. I must say I am very proud of you. I respect, the nursing profession is one of the professions that I respect most. And not because, and I'm a little biased, because I'm standing here today before you because I was inspired to come into the health profession by a nurse, my aunt. From the tender age of 3 years old, my aunt here, when I lived with her here in Jamaica, and she was in charge of the Slipe Road Clinic, and she took me to that clinic every day with her. Being loved by patients and healthcare professionals alike. And from there onwards, and when she came back home to Turks and Caicos and became the nurse in charge of the clinic there in Turks and Caicos, I had the opportunity to expand my curiosity even more by borrowing some of her instruments, injections and syringes, and experimenting on lizards and everything else. My curiosity, that led me into healthcare. So thank you to Nurse Joyce Beswick for that mentorship and inspiration. Now, we gathered here over the past 3 days to contemplate the future of healthcare under the theme Reviving Healthcare, Reimagining Healthcare Innovations and Solutions for a Healthier Future. So it is imperative that we acknowledge the rapidly evolving landscape of healthcare, the challenges that lie ahead, and the need for sustainable, innovative solutions for healthcare. This conference focused on the interconnected challenges of mental health, the health workforce, and the various social and technological innovative solutions for a future-ready healthcare system. And nurses, you are no longer the future, you are now the present and also going forward into the future. We must recognize the significant burden of mental health illness, its increasing incidence, and a myriad of contributing factors that exacerbate its impact on communities worldwide. All of you remember the COVID-19 pandemic, I'm sure. That pandemic had the effect of both increasing the awareness of mental health illnesses as well as increasing its prevalence. driven by factors such as social isolation, economic uncertainty, the fear of the illness itself, and burnout of healthcare workers and other frontline workers. Globally, more than 1 billion persons are living with mental health illnesses, which also include the neurological disorders and also substance use disorders. And many of them are living with this illness without even knowing that they have mental illnesses. And that's a troubling situation. So worldwide, however, depression and anxiety disorders alone estimate the cost of global economy, about $1 trillion, and that's not Jamaican dollars, $1 trillion US per year loss in productivity. In the Americas, mental health and neurological disorders account for about 19% of disability-adjusted life years, second only to non-communicable diseases that account for 59% of the disability-adjusted life years. In other words, 1 in 4 persons in the Americas experience mental health or other substance use disorders in their lifetime. And of course, with depressive disorders among working populations responsible for 10 million years lived with disabilities. Now, that is significant. So imagine if you add up all of the persons who have mental disorders in the years that they are disabled because of that mental disorders, 10 million years of disability lived in those individuals. A recent UNICEF study showed economies in Latin America lost over $30 billion each year due to youth mental health disorders alone. So we can see that the impact of mental health disorders is significant. And even more so when we link it as a contributor, as we learned earlier this week, to other NCDs. One of the leading causes of contribution to NCDs is mental health disorders, as we learned throughout the course of this conference this week. So these conditions really pose a substantial challenge to public health, the economic development of our countries, and also social cohesion. In addition to these systemic challenges, low and middle income countries face a myriad of other stresses that exacerbate mental health vulnerabilities. And these include climate change events such as hurricanes and tornadoes, other natural disasters, extreme weather events. And these can have devastating effects on communities, leading to increased levels of stress, anxiety, and trauma. Similarly, the increased exposure to adverse childhood events and the escalating level of violence in our Caribbean communities also contribute to the pervasive sense of insecurity and psychological distress among residents. However, in our Caribbean countries, despite the staggering prevalence of mental health illnesses and the significant economic loss, access to appropriate services and systems available to address them is lacking. So there is a large gap that exists between mental health needs and the services and systems available to address them. In fact, most people with mental health disorders, as I said, not only that they do not know, do not receive any form of care for their mental health disorders. An estimated 4 out of 5 people with mental health disorders in our countries do not receive any form of mental health care. And while individuals in affluent countries often have access to comprehensive mental health care, those in low and middle income countries are frequently left to grapple with inadequate resources and underfunded health systems. So several factors contribute to this inequity of mental health care provision. First of all, the low expenditure on mental health services, coupled with the lack of service expansion and integration of these services into primary health care. We still have lots of our mental health services being delivered in institutions. A lot of them are being delivered in a siloed approach. And so this perpetuates a cycle of neglect and underinvestment in mental health infrastructure. Moreover, pervasive stigma and discrimination surrounding mental health illness further deter individuals from seeking help, perpetuating a vicious cycle of suffering and isolation. The COVID-19 pandemic has only served to exacerbate these pre-existing challenges, further underscoring the urgent need for comprehensive mental health interventions, more so now than ever. It is essential that we prioritize mental health awareness and invest in innovative solutions to address these pressing challenges. So, graduates, I welcome your parents, your country, your relatives and friends, and shared investment in you as part of the solution to addressing these mental health challenges. Stigma and discrimination towards mental health is prevalent throughout the region of Latin America and the Caribbean and remains one of the main obstacles to improving care for those affected. Persons with mental health issues tend to conceal their illness and may not seek care or take necessary treatment. This is more prevalent in men than women, whose socialization and culture dictate that they should handle their problems without external help. Stigma and biases towards people with mental health and substance use disorders is not limited to just the general population or public. Healthcare professionals can also be at fault. So, nurses and healthcare providers here, I want you to be aware of your unconscious biases that we also have as health practitioners towards persons with mental illness and viewing them in a particular way. The negative attitudes towards mental illness by healthcare professionals have been reported in many countries across the world. The stigmatizing attitudes to healthcare practitioners can have adverse consequences on people with mental illnesses, from delays in seeking care to a decreased quality of care they provide. Accessing such attitudes is also really is an essential step for us to really assess the attitudes of health practitioners towards these patients. And we need to adopt more culturally appropriate interventions to reduce stigma and discrimination in our communities. As physicians, we are often at the forefront of healthcare system as practitioners and educators, but also physicians, their stigmatizing attitudes may also be influenced by other members of the healthcare team and also future practitioners. And this also has to be addressed. Now, when it comes to funding mental health, the majority of countries in Latin America and the Caribbean spend between 1% to 2% of their health care budgets on mental health. This figure contrasts sharply with the nearly 20% of the disease burden associated with these conditions. So looking at the disparities in investment in mental health in another way, the United States and Canada spend on average $192 per capita on mental health programs and medical care, while in non-Latin American countries in the Caribbean spend on average $24 per capita. And even so, most of this expenditure is spent on institutional interventions, healthcare buildings. So we need to focus more on community-based primary healthcare delivery of mental health that does not necessarily need to be delivered by experienced healthcare practitioners, but laypersons also within our community. Based on the known facts about mental health illnesses, their genesis and the impact on in the known solutions, we must invest more time and efforts to fund not only in reimagining, but also implementing sustainable, innovative solutions to address mental health, and also by extension, the NCDs. In Jamaica, recently, we launched a very potentially impactful innovation. and this is the wellness bench. It is possibly being modeled after the friendship bench in Zimbabwe to support persons with mental challenges and stressors to prevent or reduce long-term mental health issues. This innovation demonstrates that delivering mental health programs does not always require highly qualified professionals, but laypersons and community health workers, teachers, etc., can be trained to give support to persons with mental illnesses. Similarly, peer support groups is another low-investment social innovation that can improve mental health. Peer support can take many forms. It may be for particular groups of individuals. It could also be provided by face-to-face or on phone or online, and it may be weekly, monthly, and ongoing or unlimited time. So this is a very low-cost investment that we need to take greater advantage of. So while the COVID-19 pandemic has had a significant negative impact on mental health among healthcare providers, the population as a whole, it has allowed for the expansion of other technological innovations, such as telemedicine, telehealth, and digital health, that have increased access to mental health across all health services. The availability of virtual mental health consultations is particularly welcome in small communities where there's a high level of stigma and the need for privacy, or the practitioner is well known socially to the client. Even though the workplace can provide many stressors that lead to mental health illnesses, it could also be an ideal site for delivering mental health prevention programs and increasing access to appropriate treatment. Web-based psychological interventions delivered in the workplace are a growing and promising area of improving mental health interventions, improving employee well-being. And in a systematic review of around 21 studies examining the effectiveness of digital mental health interventions, researchers found that these programs had the statistically significant benefits for psychological well-being and worker productivity. As we look towards designing and implementing these programs in the Caribbean, internet and mobile-based interventions for mental health disorders, they need to be more culturally adapted in the local populations and within these local communities for maximal benefits. Now, during the course of this week, we also talked about the new technological innovations that are coming to the forefront to address healthcare challenges in general. And the growing use of artificial intelligence to driving virtual mental health advice to address anxiety, address stress, in terms of personal relationship issues. And these also were used, also other solutions such as augmented reality and virtual reality were being used to address issues such as phobias and anxiety-related disorders. So these are technologies that our healthcare workers and practitioners need to be well familiar with, and they themselves embrace as part of the tools that we need to work with to increase access to healthcare. Even though these technologies, however, can increase access to healthcare, they can also create inequities due to access of the technology, where there's lack of internet access in certain communities, or persons are unable to afford such technologies. So there needs to be greater availability through multi-sectoral collaboration with internet companies to make internet services free and more widely available within our communities if we want to use these tools to the benefit of patients. We need to ensure that they are more affordable. So these require significant intersectoral collaboration. Now also, in looking at our health workforce that we looked at over the course of this week, PAHO, WHO estimates that between 600,000 and 2 million more healthcare professionals, including nurses, are needed to meet the healthcare needs of the Americas. And this in order for us to build more resilient health system. To meet this demand, greater investment is needed in health for human resources for health, such as training nurses. We need to change our healthcare delivery model from a curative approach in hospitals to a more preventative approach at the first level of care. So this is a pivot that we need to do, and more investment is needed at the first level of care, what we call the primary care level, more so than at the secondary and tertiary care levels. The COVID-19 pandemic, again, has exposed the human resource gaps in our regions and highlighted our inability and challenge to scale up human resources to address emerging events. In addition, it is responsible for the resignation of many healthcare workers as part of the Great Resignation due to work-related stress and due to lack of flexibility and lack of work-life balance. Well, among other things as well. But in addition, the COVID-19 pandemic, the attrition of nurses in the Caribbean was also due to migration, particularly our well-trained nurses. And I said earlier this week that we should not apologize for training our nurses well, and Jamaican nurses are known to be well-trained, and I take Mr. Hilton's point that he made earlier. You have a degree of a kind of boldness about you, curiosity about you, and that makes you more innovative, inquisitive, and assertive in executing your duties. But so we need to train you well, and train you well enough that you can go anywhere in the world. But as I said, we need to treat you well enough that you stay here. So in order for us to address this gap and reverse the trend of persons migrating out of the Caribbean region, we need to look at what we are doing wrong. What are the factors that are leading persons to leave our Caribbean regions? Yes, we need to invest more in recruiting. We need to invest more in training. We need to invest more in retaining our healthcare professionals to create more resilient health systems. But we recognize that there's a benchmark for investment in health. And that benchmark, according to WHO, is 6% of the country's GDP need to be invested in healthcare. 6%, at least 6%. And out of that 6%, well, I will say just a few countries within the Caribbean region barely meet that 6% threshold. But out of that 6%, when you look at the health budget, at least 30% of the health budget must be invested at the primary first level of care. Because what we find is that, yes, you have a big health budget, but most of the big health budget is being invested in secondary and tertiary care, which is important. People need to live, but you never have time to catch up because those who at the primary level are still getting disease after disease. You need to stop and plug the leak. And that is at the primary care level, at the prevention level. So greater degree of investment is needed at the primary care level. We need to enhance and have ongoing skills-based training of our professionals to enable them to take up opportunities for professional advancement, to reduce stagnation, reduce fatigue, reduce burnout, and feel more productive and gratifying in their profession. We find that a lot of persons are leaving simply because they're not being challenged enough, one, or they're being stressed too much, two, not being remunerated enough, and there's no upward mobility. So they, like anyone will do, find greener pastures to move out. And the greener pastures is not always for the money. It's for your professional career progression. So we need greater strategic planning for human resources for health at the national level, for long-term sustainability in the maintenance of a well-trained and well-motivated and accurately distributed health workforce. The implementing of innovative technologies and digital health agenda and artificial intelligence-based solutions mandate the need for us to retool and retask the health workforce for the present, but also for future-ready healthcare task force. These novel and innovative technologies have the benefit of increasing access to healthcare and improving health literacy. They would and should be important adjuncts for healthcare delivery, not as a replacement for healthcare professionals who are required to enhance their critical thinking and decision-making skills and maintain key attributes such as empathy, humility, integrity, compassion, listening, communication, and problem solving. These are key attributes of healthcare delivery. Now, robots can't do many of them or any of them as yet that I know of. So when we are creating a health workforce, we're not creating robots. And you need to be able to distinguish yourself from the robots and artificial intelligence, that these are the things that make us human and to remain human and serve humanity. A recent workforce migration studies have shown that while the low level of remuneration is cited as the reason for migration, again I said, poor working, I reiterate, poor working conditions also rank highest among the reasons. And, you know, we had a session here today, and some persons may look at it and say it is out of place and out of theme for this conference, but it's certainly well in place. Because we talk about healthcare, health facilities, design, innovations, and buildings and solutions, and because it is important that those facilities are designed and built and maintained in a way to facilitate quality, delivery of quality healthcare, and also conducive to the workforce working within that environment and keep them safe and healthy. Too often we hear of healthcare facilities that are designed that are making not only the patient sick, but the healthcare workforce sick because of poor ventilation, poor lighting, exposure to it. You are the workforce, we need to keep you healthy. So having this session on understanding the need for greater investment in healthcare facilities that are resilient and innovative and productive and conducive to well-being is an important session, and we need to have more and more of that in the Caribbean region. So, if we want to reimagine a future-ready health workforce, we must recognize the evolving landscape of healthcare and equip our healthcare professionals with the skills, resources, and support that they need to thrive in this dynamic environment. We must consider some of the following. We must encourage interprofessional education and collaboration across different health disciplines, including medicine, nursing, allied professions, technology, to provide a holistic and patient-centered care. We must provide digital literacy training and support to healthcare professionals to utilize effectively these digital health technologies, telemedicine, electronic health records, and innovations to enhance patient care and streamline workflows and improve health outcomes. Yes, we know we have the Generation X and the new millennials, those ones who are maybe versed with technology, but we have the older generations and the baby boomers who are still struggling with the technologies. They need to be digital literate. And there's no shame, and they need to come on board. And digital literacy must be something that is taught and trained in our entire workforce if we want to provide quality health care and have good outcomes. We must also foster a culture of adaptability and lifelong learning among our healthcare professionals to keep pace with advances in medical science, technology, and healthcare delivery models. So your nurses, you hear, your schooling ain't done. Your training and learning probably just begun in healthcare. This is life, and in particular, probably any other of most of the professions, healthcare profession is an ongoing, lifelong learning. Because, and you learn from every patient or person you come in contact with, you learn. Because no one patient is the same. And so, the textbook may tell you one thing, and it'll give you the basics and the principles of care. But that patient condition with diabetes is different from the other patient condition with diabetes that you saw yesterday, because their family situation may be different, their socialization may be different, and so you learn from each and every one of them and use it to your benefit. We also must promote a culture of competency and diversity within our health workforce to ensure that healthcare services are accessible, inclusive, and sensitive to the needs of diverse patient population. We need to be looking at prioritizing the well-being and resilience of our healthcare professionals by addressing issues of burnout. So we need to look at flexi contracts. We need to look at flexible work hours. We need to take into consideration our workforce and nurses who have families and children and kids who have to go to school to be picked up, and who's taking care of them. While you're taking care of the sick in the hospital, who's taking care of you and your kids? So we need to be able to promote work-life balance while providing support for systems and resources for mental health and self-care. We need to enact policies, because this may be something that is probably prevalent within the Caribbean region from a culture perspective, and it's not talked about as much, but in other developed countries, it is something that is serious and has serious consequences. And it impacts the mental health of our workforce. We need to enact policies to protect our health professionals from sexual exploitation and abuse in the workplace. And this is very prevalent within our Caribbean region because it's a cultural norm. And I'm happy, I think it's here in Jamaica where they will make it mandatory for most businesses, or all businesses, to put in place workplace policies that address sexual exploitation and abuse in the workplace. Empowering healthcare professionals with access to timely and accurate data and analytics to support evidence-based decision-making, quality improvement initiatives, and population-based management. We need to ensure that our healthcare professionals are equipped to address the unique needs and challenges of the underserved and marginalized populations, to address health disparities and promote health equity. Health equity is something that, again, this is another area of unconscious bias. Sometimes we are discriminating and inequitably providing health care when we don't really realize we are doing so. Equity just stands for there are persons who have greater needs than others who are unable to support those needs. You need to give greater availability to those persons who are more vulnerable in our societies and provide enough support to them to get access to health care. We need to also be advocating for policies and initiatives that support a future-ready health workforce, including workforce development programs, funding for education and training, and incentives for innovation and collaboration. We need to ensure that our employers nowadays should not be preventing employees from seeking continuing medical education activities, but paying for them to go and get CMEs. So, by prioritizing these key points, healthcare organizations, policymakers, educators, and healthcare professionals can work together to build a future-ready health workforce that is healthy, that is equipped to meet the evolving needs of our patients and the communities that we serve in this 21st century, and hopefully beyond. So, nurses, congratulations. You have an awesome job and task ahead of you, and I wish you Godspeed and all the best as you move forward into providing the care that will address these health challenges that we have in our Caribbean region, in our region of the Americas, and that you continue to elevate yourself and engage in professional development programs that allow you to take up the highest leadership positions that will impact health in our region. So I thank you, and I thank you all for coming, and God bless. Congratulations to all.